Hi, welcome to Smith's Landing Vet Clinic. How may I help you?
Hello, this is my dog Toby, and he's been having some symptoms of a slight cough, and he does not ever want to exercise. He just sleeps every time we go outside, which is not like him at all. And he hasn't been eating very much, and which is not normal for him. He loves food. And so yeah, I just recently adopted him, so I don't know if it has to do with that. Like just adjusting to home life, because he's never lived in a home. He's only ever been in a shelter. So.
Well, all of those symptoms sound indicative of heartworm, so we're going to do a physical examination and also run some blood work. And here I have a video to provide you more information on heartworm, so we're going to play that while his blood work is being run.
Mosquitoes. Nobody likes them. They can be rather annoying little pests, always flying around your face, and even worse, they bite. And a mosquito bite can be a much more serious issue for your pet because of another nasty little bugger, heartworm. Hi, I'm Dr. Shelley Rubin. Did you know that one of the most preventable ailments in pets is also one of the most deadly? That's right, heartworm, transmitted by an infected mosquito, is a potentially fatal parasite that it can infect dogs, cats, and even ferrets. But the good news is, with the right preventive treatment, a heartworm infection is almost completely avoidable. Heartworms are pretty much exactly what they sound like. They are worms that are transmitted in a microscopic state by an infected mosquito, and then travel through your pet's blood vessels and eventually make their way to the heart and lungs. Once they get into the heart and pulmonary blood vessels, they grow to about a foot long. When they mature, the worms reproduce and create new microscopic young worms called microfilaria, which are circulating in the blood. When a mosquito bites and sucks the blood of an infected pet, they pick up the microfilaria in the blood, and then after a short incubation, the mosquito bites another pet and transmits the baby heartworms to that pet. It takes about 6 to 9 months for the worms to grow to full size, and it can be tough to notice the symptoms of an infected pet until the disease is quite advanced. Your dog may cough, become lethargic, lose its appetite, and have difficulty breathing. It's even harder to notice in cats, and sometimes a cat can suddenly die from a heartworm infection. Sounds scary, doesn't it? And it should. Heartworm is a very serious thing. But there is good news, even great news. With the help of your veterinarian, heartworm is almost 100% preventable. Preventives come in 3 forms: topical, oral, and an injectable that lasts for 6 months. The American Heartworm Society recommends prevention be given all year, regardless of where you live. An additional advantage of heartworm preventives is they also prevent intestinal worms. It's important to have your pet's blood tested annually, even if you are on a heartworm prevention all year. The cost of treating infected dogs can be quite high and also dangerous, while the cost of prevention is quite reasonable. There is no treatment for cats. Mosquitoes pose a serious threat to both pets and people. By taking your pet to the veterinarian for regular preventive care and properly administering the treatment prescribed in a timely fashion, you can help your pet avoid the devastating heartworm disease. For more information on heartworm, visit heartwormsociety.org. And for more information on pets and pet health, visit AV.
Hi, I'm Dr. Sharpe, and my vet tech Taylor told me about the symptoms Toby has been having, and the results from the blood work is back, and he tested positive for heartworm.
So heartworm is a foot-long worm that lives in the heart, lungs, and associated blood vessels of the affected pet, and it causes severe lung disease, heart failure, and damages other organs in the body. Heartworms are common to this area of Virginia because we have a lot of mosquitoes which cause heartworm. An infected mosquito deposits the larva onto the surface of the dog's skin when it bites the dog, and then the larva enters the new host through the mosquito's bite wound. Once the larva is inside the new host, it takes approximately 6 months for the larva to mature into adult heartworms, and once they're mature, heartworms can live for 5 to 7 years in dogs. From here on out, you're going to need to restrict Toby's exercise because physical exertion increases the rate at which heartworms cause damage to the heart and lungs. We will need to make sure Toby's stable enough to handle the treatment, but considering how young and active he is, I don't think that'll be an issue. We need to take some radiographs of him to check his heart for any other lesions or any other issues. So after seeing his radiographs and further assessing Toby, I think he has a low risk of thromboembolic complications. He has a light worm burden, and there's no evidence of pulmonary vascular lesions. So I don't think surgery is necessary since no worms were visualized in an EKG, and he has no concurrent diseases. It is very important that you restrict his exercise, so keeping him in a crate during the day is highly recommended. This is also a very costly treatment as there are a lot of medications involved, but it is necessary to make sure the disease is completely gone.
So here's what the treatment plan for Toby is going to be. I'm going to prescribe Toby the antibiotic dicycline in the tetracycline antibiotic group, which kills the bacteria Wolbachia that releases heartworms. It also weakens the heartworms and sterilizes them so they cannot reproduce, which lessens the damage that they can do. We are also going to start a monthly preventative to kill the larvae inside of him, as doxycycline will only kill the adult worms. I am also prescribing corticosteroids to help further reduce inflammation. This course of treatment will be about 30 days before we start the actual heartworm treatment that will last about 30 days. The next course of treatment involves a series of melarocin injections in the belly of his lumbar vertebrae, and this injection is effective against adult and immature heartworms of both sexes. To reduce the danger of thromboembolism, which is the obstruction of a blood vessel from a blood clot, a split dose treatment is highly recommended. So after the first injection is given, we will wait 30 days and then another injection is given, followed by a third injection 24 hours later. Exercise restriction is also essential once treatment has started to minimize the risk of pulmonary thromboembolism due to dead and dying adult worms. When we give an injection, pressure is applied at the site for 5 minutes to prevent drug migration. He may experience local pain, swelling, soreness with movement, and local fibrosis, which is the thickening of tissue near the site, which is not uncommon and is the reason for targeting the belly of the expenal musculature. After treatment is over, it's important to keep exercise at a minimum for several weeks. We will retest him to make sure all of the heartworms are gone, and then 6 months later we will retest him again to keep him on a monthly preventative for the rest of his life to make sure this does not happen again.
Thank you.